Looking for the best healthcare plan? Shopping for health insurance and drowning in acronyms? HMO, PPO, EPO, POS. What do they even mean? And which one will save you money without destroying your access to healthcare? Health insurance costs $599 monthly on average for an adult buying a marketplace plan. HMO plans run $562 monthly, compared to $680 for PPOs. That's $118 more per month, $1,416 per year for a PPO. But is the flexibility of PPOs worth it? Here's how to pick the best healthcare plan without getting scammed. In this video, you'll learn what HMO, PPO, EPO, and POS actually mean in plain English, the real cost differences between plan types including premiums, deductibles, and out-of-pocket maximums, which plan saves the most money based on your health situation, and the one mistake that costs thousands when you pick the wrong network. But first, make sure to sign up to never miss another money-saving healthcare advice. All of these are types of managed care plans, meaning they contract with networks of doctors and hospitals. The core differences are how you access care and how flexible or restrictive the plan is about seeing providers outside the network. Let's break down each type. An HMO, or Health Maintenance Organization, is the most restrictive in provider choice and requires referrals to see specialists, but tends to have lower premiums and out-of-pocket costs. With HMO plans, you typically need to get care from providers in the HMO network in order to use your plan benefits and get referrals from your doctor before seeing specialists. You have a personal doctor who manages your care. You need referrals for specialists. If you get non-emergency care from an out-of-network provider, you pay the full cost. HMO plans require members to choose an in-network primary care physician to help manage their care and provide referrals. HMOs will not cover care from an out-of-network provider. HMOs generally have lower premiums and out-of-pocket costs. The average deductible for single coverage policy reached $1,505. For HMOs, deductibles are often lower or non-existent. Who should choose an HMO? HMOs are ideal for those looking for low-cost, in-network care with a guided approach. If you're healthy, don't see specialists often, and want the lowest monthly payment, an HMO works. But if your doctor isn't in the network, you'll need to switch. And if you travel frequently or need specialists without waiting for referrals, you'll hate an HMO. Now, a PPO, which stands for Preferred Provider Organization. A PPO offers a network of healthcare providers to use for your medical care at a certain rate. Unlike HMO, a PPO offers you the freedom to receive care from any healthcare provider in or out of your network. PPO plans let you choose any in-network provider without a referral. PPOs will cover out-of-network care, but you'll likely save when you stay in network. PPOs may cost more, but they offer more flexibility. You can see providers both inside and outside the network. You can visit specialists without a referral, including specialists outside the network. But here's the catch. PPO plans generally come with higher premiums compared to HMOs. PPO plans often have higher monthly premiums and out-of-pocket costs than HMO plans. You may also need to pay a deductible before your benefits begin. The average deductible amount in 2024 was $1,787. For PPOs, it's often higher. The average deductible for an individual plan is now almost $1,900. And if you go out of network, be aware of the deductible, which is likely to be quite high, and the out-of-pocket exposure, which could be unlimited without a cap. Who should choose a PPO? PPOs offer maximum freedom to choose providers, but come with higher premiums. If you have chronic conditions, see multiple specialists, or travel often and need care nationwide, a PPO gives you flexibility, but you'll pay for it. HMO plans average $562 monthly, while PPOs cost around $680. Over a year, that's $1,416 more for flexibility. Next, EPO, meaning Exclusive Provider Organization. An exclusive provider network plan only covers care from doctors in its network, but the network is usually bigger than an HMO network. You might need a referral from your main doctor, or you might not. Premiums are higher than HMOs, but lower than PPOs. An EPO is a type of health plan that offers a local network of doctors and hospitals for you to choose from, but networks are generally larger than HMO networks. An EPO is usually more pocket-friendly than a PPO plan. However, if you choose to get care outside of your plan's network, it may not be covered except in an emergency. Unlike an HMO, you don't have to pick a single primary care doctor to manage your care. You can visit any doctor or specialist within the network directly. No referral needed. But EPOs have one major restriction. Coverage only applies if you see doctors, hospitals, or providers within the approved network. Go out of network for non-emergency care, and you pay full price. Who should choose an EPO? EPOs strike a balance by offering flexibility without referrals. If you want lower premiums than a PPO, don't want to deal with referrals like an HMO, and your preferred doctors are in the network, an EPO works. But verify your doctors are in network before enrolling. One surprise out-of-network bill can cost thousands. Finally, POS or point-of-service plans. A point-of-service plan is like an HMO but more flexible. You might still need a referral from your primary care physician to see a specialist, but you can also see doctors who are out of your network. Out-of-network care will cost more. A point-of-service health insurance plan combines features of HMOs and PPOs, offering flexibility in choosing healthcare providers. Unlike HMOs, POS plans allow patients to see out-of-network providers, though at higher out-of-pocket costs. A unique aspect of POS plans is the requirement to choose a primary care physician who manages referrals and coordinates care. Who should choose a POS? POS plans combine the structure of an HMO with the out-of-network options of a PPO. If you want a primary care doctor coordinating your care, but occasionally need out-of-network flexibility, a POS plan is the middle ground. But understand the costs. Out-of-network care will hit your wallet hard. Now, the real question. How do you actually choose? Before you start looking, make note of your need-to-haves and want-to-haves in terms of your provider network and benefits. Also, list any doctors or hospitals you want access to. Step 1. Check if your current doctors are in the plan's network. Check the networks you're considering for doctors, hospitals, and pharmacies near you before making any decisions, especially if easy access to care is important. Call your doctor's office and ask which plans they accept. Don't assume. Networks change annually. Step 2. Calculate your total costs, not just the premium. Deductibles, copayments, and coinsurance can add a lot to your total yearly costs, sometimes more than a plan's premium. Copays average $26 for a primary care visit and $42 for specialist visits. As of 2025, the out-of-pocket maximum is $9,200 for individuals and $18,400 for families. If you visit specialists monthly, a PPO with a $680 premium but $30 specialist copays might cost less annually than an HMO with a $562 premium, but $50 specialist copays, plus referral delays. Step 3. Match the plan to your health situation. Healthy and rarely see doctors? HMO saves money. Chronic conditions requiring multiple specialists? PPO or EPO gives access without referral hassles. Travel frequently for work? PPO offers nationwide coverage. Tight budget but needs some flexibility? EPO or POS balances cost and access. Reevaluate each year. As healthcare and your circumstances change, the ideal plan type for you might change. You're not locked in forever. During open enrollment, compare plans again based on how much healthcare you actually used that year. One final note. This video is not financial advice. Always do your own research and consult with a professional for your specific situation. Here's what to do right now. List your current doctors and specialists. Call each office and ask which plans they accept for next year. Calculate your expected healthcare usage. How many doctor visits? Prescriptions? Specialists? Use the plan comparison tool in the description. Input your doctors and medications. It shows which plan covers them. and estimates your total annual cost. Then pick the plan with the lowest total cost that includes your providers. Next video, we're breaking down health insurance subsidies, who qualifies, and how to get thousands in free money to pay your premiums. Subscribe so you don't miss it. And if this just saved you from picking the wrong plan and wasting thousands, hit the like button.